everyone. I'm not against allopathy. It has some great life-saving surgical procedures, some emergency medicines that no other form of treatment can match, and we're not even trying to do so. But one really unfortunate thing that it has caused is that people have started believing in the concept of health, which is very superficial. People believe that when they get a bacterial infection, antibiotics can take care of them. When they develop allergies, anti-allergics are enough. But in this concept of disease being caused only by the pathogen, mental health or stress is completely ignored. Now, imagine during a pandemic or an epidemic, when most people are affected by a disease caused by, say, a virus. Why do some people develop more serious symptoms while others are asymptomatic or are less affected by the same virus? If it was only the pathogen, why did not everyone get the same intensity of disease? So we come to another concept, susceptibility. We are more susceptible to some infections. Some people are more susceptible to diseases and they get those diseases accordingly. They develop symptoms accordingly. And this susceptibility is greatly influenced by stress. So when you're more stressed, you're more susceptible to getting diseases. And it is not just chronic diseases. We do understand, people have started understanding that chronic diseases are caused by stress. Autoimmune diseases are triggered by stress. But acutes and all the ailments, in fact, are greatly influenced by stress. It reduces your immunity, so you get more diseases. Now, when patients come to us, we often have to individually educate people why we want to know their stress, why we want to know if their mental health is, if they're doing well mentally or not. Because they don't expect the doctor to ask these questions. That is the allopathic concept of disease and health. They only expect the doctor to know the physical symptoms and prescribe accordingly. And we often have to individually tell them that we need to know their stress to prescribe, because homeopathy takes into account the patient's stress, the personality symptoms, because health is very closely connected to stress. So I hope there comes a time when people know it by themselves that if they got sick, some stress triggered it, and they're open to sharing it with the doctor, because that makes us prescribe better. So if you're planning to take homeopathic treatment, you need to be open to this idea of sharing your stress. The better you share, the more easily you can be prescribed for, especially in classical homeopathy.